is it, because I know the premenstrual phase is towards the end of the second one at the bottom. I was trying to figure out the timeline, but it's talking about that dip there. But do you see the plateauing of the estrogen?
Right here?
Yeah.
And the question is about this.
I guess what's happening there, or I guess, I don't know if we covered.
Yeah. We're not going super deep into it, but the corpus luteum is also producing estrogen, but not as much as progesterone.
Okay.
But the important thing here is that as corpus luteum, it's kind of on a timer, and it's also receiving messages from the rest of the body. If no pregnancy has taken place, it will receive that information, and it will break down and become corpus albicans. I don't care for you to necessarily know that term, but basically it's just like a shell of itself, and therefore it's now not secreting any hormones. Where is this coming from that is left here? Well, there are later cohorts that are developing, and therefore they're secreting some estrogen. So that's kind of, this is where it's just very difficult to do in 1 week because there's so many things happening at the same time. So we're just focusing on the fact that, hey, progesterone is dominating in the second half of the cycle because corpus luteum is stimulated by LH, luteinizing hormone, to produce progesterone. Okay. And that progesterone is what's making us kind of not, well, we'll get to that in this thing. Here, when you see a drop in the hormones, that is when the uterine lining, the endometrium, specifically stratum functionalis, is going to start breaking down. But we don't see the effects of this, meaning no blood is coming out, until a few days later, just because it needs to accumulate enough to actually bleed out of the body. But this is where it's breaking down, is where corpus luteum is involuting. Yeah, Brandon?
So if pregnancy had occurred, or implantation occurred, that's when the placenta would take over and it would stay level instead of dropping?
Absolutely, great question. Okay, and I should have said this, so I'm glad Brandon brought it up. If implantation takes place, corpus luteum will not break down, and it will stay active for several weeks, secreting more progesterone. It will not fully break down until like week 12 of
I
pregnancy.
think it's like the trimester.
Yeah. So the first trimester, or when we think of a pregnancy in the first trimester, where like all of the organ systems get developed, corpus luteum, which is so that egg has now been fertilized and is growing into a fetus, and the follicular cells from that follicle that had that egg are secreting progesterone for that whole first trimester. And they will be stimulating the growth of the placenta, but that placenta is not really going to be fully developed enough to support the baby until at the end of the first trimester.
But those hormones will stay consistent
Relatively consistent, yes.
throughout the pregnancy.
Throughout, I wouldn't go that far, but throughout that first trimester, and they're not gonna go through the same pattern, but they are going to change somewhat throughout the pregnancy. So, days 1 through 14, dominant follicle fully matures and bursts, oocytes released from the ovary. We call that estrogen dominant phase because all of these granulosa cells are secreting estrogen. In the uterus, that means the uterus will be stimulated to grow a thick new functional layer of endometrium. This is kind of a summary, and when you get really lost with all of these overlapping things, go to these summaries. Because I'm not going to expect that you can answer some super duper deep questions on this in 1 week's time. First half of the 28-day sexual cycle of the female is dominated by estrogen that is released from granulosa cells as follicles develop. And we're developing many follicles, and they're all releasing estrogen, but in the end of that first part, we will have one dominant mature follicle with a secondary oocyte in it, ready to ovulate. Luteal phase is the second part because we have corpus luteum left in the ovary from the ovulated follicle. And we call that phase progesterone dominant phase because corpus luteum cells are stimulated by luteinizing hormone, luteal phase, corpus luteum, luteinizing hormone, stimulating that that corpus luteum to secrete progesterone. It will also secrete inhibin and some estradiol. And then there's some complex interplay of these so that we do not stimulate gonadotropin releasing hormone because we don't want the other follicles to be developing yet. Because we're just focused on maybe this one will get fertilized, so we don't need new ones to be coming up yet. Right? If there's no pregnancy, corpus luteum degenerates and stops inhibiting pituitary, then follicle stimulating hormones will rise again and stimulate new cohort of follicles. What's happening in the second half of the cycle to the uterus? Endometrium thickens. The progesterone does not make mitosis happen in the uterus. The progesterone makes the cells that are already there, that grew from the estrogen stimulation, to get thicker and release more substances from the glands. Progesterone makes it get bigger, thicker, not by mitosis, but just growth. Glycogen secretion from endometrial glands. Endometria is thickening because the cells are getting plumper, not because there's mitosis. Endometrium is now moist, thick, fluffy, nutritious bed available for embryonic development. If no pregnancy happens, then progesterone will fall sharply and we will have what's called endometrial ischemia. The word ischemia means lack of blood supply to an organ through blood vessels, like cardiac ischemia is heart attack. And that causes the spasm, death and spasm of the functional layer or porta stratum functionalis. It is thought that this is why it hurts, is because you're basically taking oxygen away from live living tissue and it has receptors for pain. No progesterone from corpus luteum. Now gonadotropin releasing hormone is no longer inhibited. So you can start a whole stimulation thing of a new cohort again. So this could potentially be a question. High progesterone from corpus luteum makes your brain think you're either preparing or maintaining a pregnancy. So GnRH is not secreted and therefore you're not stimulating new cohorts of development in the ovaries. When the corpus luteum breaks down because no pregnancy took place, progesterone falls. Corpus luteum needs to be connected to progesterone in your mind. And progesterone is stopping development of the next month's follicles. So it's like estrogen is developing new follicles, progesterone is stopping the development of next cohort, but it's maintaining conditions for the ones that have already developed, for the one that has burst from ovulation. Okay, there's a lot, and for the summary, and of course the different books have different timing and naming, but it might be helpful to answer some of your questions. Okay, what we're gonna do right now is we're gonna look at Angela's story. So there's gonna be a bunch of recall questions, like what's happening in the first or follicular phase of the sexual cycle. But then there will also be some application questions, And they will be very based on this type of stuff that we have in front of us right now. So I want you to feel confident in what the hardest questions are gonna look like for the final. So here we are. Let's read the top part. I'm gonna read this intro. You are a columnist for a popular website that deals with women's health issues. Visitors on the site can submit their stories and questions through an Ask an Expert link on the site. In this scenario, a 26-year-old woman named Angela has posted her story and some questions regarding reproductive health. Would someone read that first paragraph, please? Clark, thank you.
For the Angela one?
Yeah.
My name is Angela. I am a 26-year-old married woman with no children. My husband, Doug, and I have been trying to get pregnant for over 2 years now, and my doctor has suggested that I consider fertility drug treatments. The irony of our situation is that I've been taking a birth control pill for 5 years to prevent getting pregnant, and now my doctor suggests that I take another drug to help me get pregnant.
Very relatable for many women. A second, would someone read the second part?
When I went off birth control about a year ago, my menstrual cycle became very irregular. I've been taking a birth control drug called orthotricycline. To be perfectly honest, I don't understand how it works because my periods were more regular when I was on the pill than when I went off of it. My doctor told me that the pill works because it tricks your body into thinking that it's pregnant. That just confused me even more.
When I looked back on my decision to take birth control pills, I realized that I did not really understand how they would work. I just do not want to make that mistake again. Before I consider taking any more drugs, I want to understand more about how they work. The drug we are looking into is called Clomid. I asked my doctor a bunch of questions, but I still feel confused. I looked up some stuff online when I got home. Here is some of the information that I learned from a website about how orthotricycline works.
Okay, so summary, there's a woman who's been on a birth control medication called orthotricycline. That's to prevent pregnancy. Orthotricycline is like a very common hormonal birth control. She is now off of the pill, the birth control orthotricycline, and has been trying to get pregnant with no medication, but pregnancy is not happening. She is being recommended to take Clomid, which is a different drug that is trying to do the opposite thing, make increased chances of pregnancy. She did some research on what did the birth control do to her. So what she read from some website, supposedly, is estrogen and progestin, which is a synthetic form of progesterone, work in combination to suppress the hypothalamic pituitary ovarian axis or gonadal axis. This suppression leads to a decrease in the release of gonadotropin releasing hormone from the hypothalamus, luteinizing hormone, and follicle stimulating hormone from the anterior pituitary. Maturation of the dominant follicle is inhibited under the decreasing levels of FSH and LH. Okay, so if gonadotropin releasing hormone is inhibited, it's not allowing LH and FSH to be released. Those are the things needed to develop mature follicle and cause ovulation. Therefore, ovulation does not happen. Mature follicle does not develop. Hormonal contraceptive use also leads to an increase in the viscosity of the cervical mucus, which inhibits sperm penetration and movement through the cervical canal. That's just like a secondary side effect from these synthetic hormones. I'm hoping that you would be able to help me understand how these drugs actually work and what she's trying to get, like, should I now, if I understand this, maybe I can understand how this next drug might help me and therefore make an informed decision on whether I should go on more drugs. This is actually a very realistic scenario. So what I would like you to do is, as usual, find some people, because when you talk through things and ask things, you're actually learning and remembering more than if you're just doing it completely on your own. So find the person. Like every bathroom I went to during break was closed or in use, so, which is nice. I'm gonna go to the bathroom and I will come back and I hope you are working with some folks near you. Just go one by one through this. I'm gonna leave this up.